Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Hey everybody, and welcome to another episode of the Better Outcomes Show. I'm Rafi Salazar, your host, but you already knew that from the intro. If you're new, thanks for showing up and spending a little bit of time with us. Our goal here at the show is really just to explore the possibilities of a new healthcare. Sometimes that means we're talking to a business professional or an entrepreneur, maybe bringing a new business model or a new product to the market. Sometimes we're talking to academics about research and clinical decision-making. And then, like today, we're talking to a boots-on-the-ground clinician who's doing something novel or innovative. My guest this week is Lauren Sheehan. She's an occupational therapist, and she's involved in, for lack of a better word, the tech space, technology and rehabilitation. So hope you enjoy this interview. Before we get to it, I just want to mention, if you are new and you want to subscribe, you can go find us at iTunes at the Better Outcomes Show. You can find all the places to follow, subscribe, download, all that kind of good stuff at www.betteroutcomes.show. Now, I think I say this a lot of times, just going back listening to all the other episodes that we've done to date. And I always want to say something along the lines of, I'm excited to bring you this interview. But I don't think it is any less true today than it was on the first interview that I brought to y'all with this show. I think we have just got a lot of good guests on the show that kind of vary in their experience and their approach and their role within the healthcare space. I like being able to have conversations with people that are in academia and doing research. Part of my background as a former academic at a graduate program doing research, I'm always kind of thinking about it, and it's got part of my conscious mind. Cognitive capacities are still very much involved in clinical decision making and that sort of thing. But then being able to talk to boots on the ground clinicians who are doing things that are really cool and are non-traditional. You know, I myself came from a standard specialty outpatient rehab clinic doing treatment and providing treatment for veterans at the VA experiencing chronic pain, experiencing musculoskeletal issues and post-surgical rehabilitation. And I was very blessed early on in my career, really like 5 years into my clinical career, to step away from that a little bit to do some management consulting in the state of Georgia, doing projects that involved policy writing and standard operational procedures and clinical guidelines and providing clinical oversight to a whole state system. And it's just really, really cool to be able to step away from the clinic to do that kind of stuff. Now, I've recently purchased a physical therapy clinic, and now I'm getting back into doing hands-on care again, which I'm excited about. And I think ultimately I got into healthcare because I like building relationships with people. So I'm looking forward to doing some of that again. But I know that a lot of the people that reach out to me and a lot of the chatter that I see on the interwebs, on the forums here, are really a lot of clinicians that are maybe doing the staff therapy thing. They're working as maybe a treatment lead or lead clinician, and they're looking for something different, something interesting. And my guest this week, like I mentioned, Lauren, really has done a great job in her own personal career of kind of taking that plunge, if you would, and leaving the world of just standard clinical care and moving more towards integrating new technologies. So a little bit about her before we jump in. Lauren has been an OT for a number of years. She did the clinical thing as well and was a rehab manager But then she stepped away to work on a couple startup companies in the rehab tech space. So the first one was Neurofect, and now she's at Neurolutions, and they're basically bringing products to market that are specific for patients experiencing neurological deficits. So patients that have had a stroke, perhaps. And the one that she's working on now, she talks a little bit about in the forthcoming interview, is pretty interesting. It's like a brain computer interface, which is pretty sweet. And as a clinician out there listening, you might want to, be tempted to think, well, how could I ever get involved in that? Listening to her story is just pretty cool. So we talk a little bit about her story, how she decided to make the shift from a clinician to sort of a clinic manager, clinical consultant in the tech space, in the UX design, and then market development or product development space. And then we talk a little bit about how do we get organizations, clinics, individual clinicians to incorporate some of this new technology. Because again, as we've heard on episode, I can't remember which episode it was, where we had Darren Schwindeman on from Creative Distillery talking about knowledge translation. If there's not a system in place for the carryover of whatever technology, it could be the best tool in the world, then it's not going to take hold the way you want it to. So we talk a little bit about that. You've got this new technology. What's the best way to implement it in your clinical practice so that it gets used appropriately, gets used on the right patients, and the patients ultimately get the benefit of this tool to help improve their clinical outcomes, right? That's what we're all about at the show, better outcomes. So I hope you find the interview entertaining and insightful. I know I enjoyed talking with Lauren about all of it, about the tech side of things, about some of the behavioral psychology side of things, and making and the knowledge translation and making it stick, so to speak. And then she also shares a little bit about their upcoming Rehab Tech Summit. I'll link to all of that in the show notes if you want to go read about the virtual summit that's going to be taking place in February. Register, sign up if you're interested in that kind of thing and you want to learn more about it. I know they've got a lot of speakers lined up, a lot of cool tracks, one for folks that are in the clinical world trying to make a career transition into working in tech, and then also connecting developers and investors with clinicians. So it's a pretty cool summit it looks like they're putting together, and I'll link to that in the show notes. So without further ado, here is Lauren Sheehan talking about technology in rehab. Well, hey, Lauren, welcome to the show. How are you?
Thank you. Thanks for having me. Doing well. How about you?
I'm doing all right. Can't complain. Before we jump into the topic at hand, which is all about tech in the rehab space, why don't you tell us a little bit about yourself and your work?
Absolutely. Um, I have been an occupational therapist for, gosh, it's easy to lose track, for about 14 years. And I started out in outpatient um, neuro practice. I've really been in neuro my whole career. And about 4.5 years ago, I had an opportunity to transition into an industry role, which I know we'll talk a little bit more about. But essentially, the first startup that I worked for all of my work in tech has been in the startup space, I'll preface. And the first startup I worked for was developing rehab technology for individuals after stroke. And I've kind of followed that same path with my background in neuro, have always been in technology development that serves the neuro population. So left Neofect is the first company that I worked for to come on board with another startup by the name of Neurolutions, and we are developing brain-computer interface technology for stroke rehabilitation as well. So made the leap from long-time clinic practitioner, spent a little time in administration and management to kind of learn the business side of healthcare, and then moved over into the technology development space and absolutely love it on the
Yeah.
industry side. Yeah.
Well, let's hang out here for a little bit. So what made you decide, like, okay, I'm a clinician, I think a lot of people naturally think, okay, I'm a clinician, I'll go be a manager, I'll do some administration. So what was it for you that like made the switch in your mind to say, I'm just going to do something totally like leave my job and go work at a startup in a technology oriented field?
Yeah, absolutely. Well, it's interesting to tell that story because for me it was really accidental. um, I think in our careers as therapists and just as humans, we're kind of always following the next thread that's pulling us along. And I had an opportunity to work with a patient who introduced me to a piece of technology. He was using at the time, the NeoFect Smart Glove as an early beta tester, and his family was very much into tech. He himself was a game programmer by background, had a stroke in his early 40s, and we were just looking for something to really engage him in therapy at home. And so he and his wife found the product, and at the time, there were few home based users, and folks from the company got involved and just wanted to know more about him because, of course, with his technology background, he had a lot to say about the product and how he used it. And then I got involved in giving feedback as his therapist, as his home based therapist. I was seeing him private practice at the time. And one thing led to another. And as I was working with him and the product and, being asked for some feedback around the usefulness of the tool and the clinician experience and using the technology as well as the patient experience, I just really fell in love with the creative process of seeing something move from kind of its current state to evolution and getting better to serve the patient. And we get to see that in small ways, I think, in the clinic. But
Yeah.
I think with technology and technology development, that trajectory can happen a little bit more quickly. And for a startup, it's all about, kind of iterating and continuing to make improvements. And so I think my love of seeing client improvement and seeing clients be served in a clinical setting, and of course, my passion for neuro, as well as being able to serve a larger scale of patients and kind of a population-based way. If I'm on the side of helping companies develop technology that can better serve our individuals post-stroke, it just seemed to me kind of like a no-brainer. So I courted the company for a while, or they courted me. It was probably kind of a mutual courting.
Yeah.
And about 6 months later, we sort of co-created my job to come on board. And I was the first US clinician on the team at the time.
Okay, cool. And you were kind of like a clinical advisor of sorts to
Yeah,
this company?
my title was clinical manager, which within rehabilitation technology companies, that's kind of a standard title or role. Someone to speak the voice of the client and speak the voice of the clinician uh, as the product is being developed. As sales and marketing are being developed, I'm kind of being that patient and clinician voice of the user.
Yeah. Well, and kind of on that line, so you went from being a clinician to being this clinical director or clinic, what was the title?
Clinical manager, but
Clinical manager, yeah, where you're kind
semantic.
of providing some advisory services to both to the company that's working for you, maybe, or that you're working for, and maybe even the clinicians that are trying to implement the
Absolutely.
technology. Like, what kind of adjustment period was there for that? And did you find like any of the clinical skills that you had carrying over well into that role? Or was it kind of like man, I got to hit the books and learn a whole different skill set or mindset even?
Yeah, I mean, it's a great question, and I think for those like you that have open practices, when we get anywhere outside of the clinic, we're using a different set of skills. But of course, there are some things that cross over pretty seamlessly. I think for me, in working for a startup, was just understanding how startups work. That's a whole learning curve and kind of a
It's a different
whole
culture, right?
a whole different culture and a different set of terminology and really a different business model and a different set of stakeholders. If you're within a clinic setting, you have, your business stakeholders. Obviously, you have your clinicians that are involved in the business model, and you have your patients as stakeholders. But when you work for a startup, especially investors and the board, you've got a whole nother set of folks that have a vested interest, quite literally, in the success of the product and of the approach to, improving patient care, if that's your desired outcome. So just a different business model, different stakeholders, as kind of folks to answer to, and bring into the loop about what it is that you're developing, as well as, I would say, different leadership structure. Some of and many, especially early stage startups, are scrappy and very
Yeah.
small, and you wear so many different hats. I was talking to another therapist that's had startup experience recently, and it wouldn't be unlikely for me to answer the phone on a customer service call, or to troubleshoot tech with a clinician or a business partner. Like, you just kind of do everything, develop marketing materials. So I think being comfortable not knowing and being willing to jump into some of those roles and learn as you go, just, as a member of the team and trying to contribute in any way possible, was a little different. Your streamlined role in the clinic has a little more definition
Yeah,
than
for sure.
wearing a startup hat, for sure.
Yeah. Well, I don't know. I don't know about you, but I love that. So I'm involved in a startup right now with we're continuing education, CRA learning. But there's 6 of us or 5 of us on the team. And it is like one of those, well, maybe I'm going to handle the marketing this week, or you're going to be answering an email. But part of that is, so for me anyways, is almost invigorating. Like, I like
It's
some of the
super
spontaneity
exciting.
of what happens. Yes.
Absolutely. Yeah, you definitely have to give up the need for delineation of
Yeah.
roles and just have, I think it requires better communication in terms of kind of the cross functionality. But I would say that that's another thing too. I hadn't ever worked directly with engineers and product developers and software people previous to this role, and now in my current position, I have moved into a little bit more of a product manager role. So I'm regularly interfacing with our developers and with our designers and working on, UI implementation and user research. And so really into kind of the tech creation. And I think that came with time and being able to sit at the table with these cross-functional teams and learn about kind of how I could bring value. The other things you had asked about, kind of what carried over from the clinic, I think the biggest thing that I saw, being able to translate well is just our ability as clinicians, and particularly in the therapeutic space, of relationship building. Most businesses are relationship
Yeah.
businesses, and technology is no different. You're developing relationships with your stakeholders, which are many, the clinicians that are interested in using your product, the key opinion leaders that you want to, give input on the direction of your product, the users, of course, the end users. But it's really a lot about relationship building and leveraging those relationships to continue to make product improvements for the betterment ultimately of the client or that end user.
Yeah. Have you found it kind of difficult to, I guess, so I was in clinical work for a long time. Then I went and did consulting, did some policy work, did a lot of marketing for other organizations. And at some point along the line, at least I found it difficult to remember that the whole reason I got into doing what I was doing was because of patients, right? Like, I imagine in the tech space, you're developing this technology and you're looking at hitting your next series of funding and, all of that, that it can be easy to kind of miss out on that. Did you experience that at all, or has it always been, since you're called to neuro, you're kind of in neuro, it's all kind of gelling for you?
Yeah, it's super great question. I mean, I think in the time of COVID, things have been a little bit different for all of us, right? So we've had to connect with our users in a different way, but it's allowed us to open up some doors to having online focus groups, with past research participants, and just getting creative about how we continue to keep the lines of communication open with that end user in mind. One of the things that I've been really passionate about is making sure that other members of the team, that because I've really tried to, and have been able to maintain kind of that relational aspect with the client. Either there's a product that I'm actually working with, teaching them directly. For the first company I worked for, we had a direct to consumer product, so we would, set up training sessions and actually train the end user,
Oh, nice. Yeah.
using telehealth technology, and so lots of interaction with the actual user of the product. The company I'm at currently is doesn't have a product yet on the market, so we're very much still in kind of research and development mode. But making sure that my team members that are not clinical are introduced to patients and end users and get a chance to hear from them about their experience of their stroke or whatever the scenario is. Get a chance to even see simple things like how they move and how things like spasticity influence the use of the technology that's being created. So I think it's really important to make sure that everyone on the team has a clear picture of who they're serving. And
Yeah.
that's just, that can be challenging when you're dealing with people that are kind of at all, in all aspects of product creation.
Yeah. Well, and I'm sure for a clinician, maybe on the receiving end of like a sales message or a marketing message or something, and I've been in that situation, I'm sure you have too, where the person is trying to explain the product and you can tell that they have no idea how it's going to be used in the clinic. They just think it's a really cool piece of technology. And as a clinician, you're like, yeah, that's not going to work in this situation. At least it's not going to work for me. But they don't get it because they've never had that conversation with a clinician about the application of the technology, right?
Absolutely. And that's how a lot of startups start. I came on board with a startup that already had a product on the market, that was already putting product in the hands of patients and clinicians without a clinician on board, and
Yeah.
it's amazing that that still happens. And that's another one of my, soapboxes. And one of the reasons that, I was so excited to create this community of the Rehab Tech Summit is we want these early stage companies that are in product development, that have this really great idea, that are trying to bring it to clinicians and patients, to get clinicians involved in the development process as early as possible. So they're not creating something that either doesn't have value or that is going to be very difficult to fit into the models, of clinical practice that are currently happening. So yeah, definitely another one of my soapboxes. And I think, clinicians are well positioned to be in that early group of um, professionals that can provide our insight about the client experience and the clinical experience. How does this technology fit our models and the constraints of the clinic and the demands of the clinic, and does it bring the value that it needs to get over the hurdle there?
Yeah, yeah. Um, well, that's a great segue. Like this whole idea of we understand kind of the clinical side, the application. So in rehab in particular, which is where I'm an occupational therapist, you're an occupational therapist. We hang out with a lot of other therapists. In the rehab space in particular, where do you see the biggest potential for either using a new technology or implementing technology that's already available to better the outcomes for our patients?
Yeah, great question. I think our powers of observation as clinicians and our ability to assess with our eyes and our experience is really powerful. But I think the ways that technology can be leveraged to help us continue to sort of hone those observational abilities is just to be able to provide us with metrics that we can't see with our own eyes. For example, in neuro rehab, the trajectory of stroke rehabilitation, particularly upper extremity rehab, is long and
Yeah.
arduous for a lot of our patients. And sometimes it's difficult as a clinician to be able to provide all the level of detail that we need to really argue that we're making a difference in the patient's, functional outcomes. Because that process of improvement of quality of movement and, limb functional improvement over time can be so slow, I think we need some of the metrics that technology can provide us to show change, whether that's a measure of improved smoothness of movement or some force metrics that we can get from different pieces of technology in the clinical setting. Um, or even, things like skeleton tracking that can tell us a degree of movement from or shift from midline that we might be able to see with our eyes, but can't necessarily quantify. So I think it really helps us dive deeper into a data-driven kind of objective approach to measurement of improvement that can help us speak to the value of our care and provide some more data that really allows us to say, yes, we're making a difference, and maybe we're not quite to that next stage of function for this patient, but this is how they're improving, and this is how it's making a difference in their life.
Yeah, no, that's really interesting. You bring up the whole data. Big data is huge now these days, especially in the healthcare space. But I did a project for a startup in the space, and they were basically a platform that they were using for treatment, more or less. And I brought up the point of like, why are you not using? It was integrated with like a camera, and they were picking up the patient. I was like, why are you not trying to gather data? And the person that was running it, who was not a clinician, said, well, we don't want to overwhelm the clinicians with data, but it is a very useful treatment modality. And my thought was, as a clinician, that's what I like. If I could use it as a treatment modality and it's delivering data to me that I can then turn around and justify the treatment or the continuation of treatment, is just that would be the win-win for me. But it's funny that some folks just haven't gotten that yet. So
Definitely. And to your point about big data, when we have enough data and enough data sets, there's so much opportunity to leverage understanding more about the trajectory of rehab. We can collect a lot of data on a lot of patients using technology over a shorter period of time and to a pretty, good degree of specificity. And then we can start to see trends and use things like AI to even have some predictive modeling around patient improvement. I don't think we're quite there yet in rehab, but we're definitely headed in that direction. And I think technology can help us have a better understanding of this type of patient, given these inputs and these types of interventions. Generally see this trajectory of improvement, and I think it can just help us also, to your point, justify our treatment a little bit with a little bit more granularity.
yeah. Have you discovered, or have you seen, because at least one of the things that I see in the big data movement is the idea and the temptation to simplify everything down to a number, right? Like, unfortunately, the people that are running the numbers and the data spreadsheets, calculations, and all that kind of stuff don't come from a clinical background, right? They're data science folks, they're data analytics folks, and the tension, let's call it the creative tension between being able to project based off the data that we have what treatment might look like and what we can justify versus the individual situation. Mr. Smith that just had a stroke, and maybe he's got different factors, be they psychosocial or physical, then that might alter his treatment path, right?
Absolutely. And I don't think it's ever particularly in neuro, going to be a plug and play
Yeah.
situation, right? That's why clinicians will always be needed to use that clinical reasoning and to look at all of the patient factors. But I think there are some things that we can learn on a more, uh, on a greater scale than we've even had the data to start assessing.
Yeah. Bigger
Um,
patterns, right?
yeah, bigger patterns, bigger projections, just an ability to look at a lot of people in a similar state over a longer period of time, again with that level of detail that we don't necessarily have access to now. So will it allow us to sort of, yeah, plug in a patient scenario and get an output? I don't think that's necessarily the goal, and I don't think that we'll get there, but I do think that there will be some important learnings from big data down the road.
Yeah, it's funny. I think I had this conversation with the guys from Tracer on a recent episode, and they do AI technology for something for to quantify movement. And we had the conversation about, well, is AI going to replace therapists? You know, and even he runs this AI company. He was like, no, there's always the best clinicians are always going to have a place because you need the clinical reasoning.
Absolutely.
Um, but if you can use AI as like a force multiplier to really up your effectiveness, then that's where the money is, right? Right?
Definitely. And I think it's just a call to therapists to see, and to the rehab community to see what is possible with some of those metrics. And I just don't think we've embraced enough of that kind of data modeling in rehab science to really even know what we could glean from
What the
it at
potential
this
is.
point. Yeah.
Yeah. Well, and that kind of leads into the next series of questions, which is what are the challenges? Like why hasn't this taken more of a flight in the rehab community? Because obviously reimbursement keeps going down and it's harder and harder to justify treatment. So there has to be some kind of hang up why clinicians and organizations aren't reaching out to something like technology that can give them the data that would justify their existence, right?
Yeah. I think we sometimes get stuck in the models that exist, limiting us from using what we could have access to in the data, or kind of the potential of technology to tell a different story. It's hard as a technology provider to sometimes get in the door just because those barriers to bringing something on in the clinic, there's a cost, right? There's a time component to training. As a clinician working in neuro for years and years, over the course of my clinical experience, and I'm sure yours and everyone's that has been practicing now for a while, just having to do more with less in the clinic makes technology adoption more challenging because I think for many clinicians and probably even on the administrative side, it's sometimes seen as like one more thing that I have to implement into my already really strung out
Yeah.
practice. And so I think that that's probably one of the largest barriers to entry. The cost, time wise, and dollars for the perceived value, particularly if I haven't, gotten a chance to really see whatever this new technology is make a major difference in either the quality of my care, the outcomes, or the data that I can use for justification. It can be hard to get in the door for a lot of technologies.
Yeah. Well, and have you found things like, I don't know, EMR integrations or things like that helping that? Because if it's like, I'm just thinking, so I own a physical therapy clinic and we have things. And if I knew that we could implement this technology and it would automatically integrate with our EMR and it would help the clinician's documentations, I'd be like, that's a no brainer. Let's do it. But a lot of times you're dealing with it's clunky, right? You got to do it over here, then you got to copy and paste, and you got to move all this. And some even the clinicians are like, I don't got time in my day to do another thing,
Absolutely.
right?
Yep, yep. Another platform, another place that I have to log into, another thing that I have to learn how to manage, another potential opportunity for equipment to break down. I mean, there are a lot of things that more time potentially in my session to set it up. Yeah, I do think interoperability, of course, is hopefully the way that we're going in a lot of facets of tech related to healthcare. And I think in order to truly be a solution that has the value in time and dollars, we have to get closer to being able to, create the APIs that allow us to dump data more easily into the EMRs. And of course, there are challenges there, right?
Yeah.
Gatekeeping, it's very sensitive information. Opening some of those doors is really challenging to even get access for some of that integration. So I definitely think that would help in the uptake of technology, but we've got some hills to climb in terms of being able to integrate solutions. But absolutely, I think as much as we can make it easy to see that value and to communicate it in our documentation and to our payers, the more readily we'll see clinicians and facilities being willing to bring on new technology.
Yeah. Have you seen in your work, have you seen like a model, if you would, of implementation that kind of works good given our kind of disjointed healthcare system?
Yeah, I think, the facilities that really do technology adoption well have typically dedicated teams. Um, a committee, for example, that is looking at technology, so if a company comes in with a new tech product, there are a group of cross-disciplinary therapists that are sitting down and saying, how does this fit with what we're already offering? Does it serve a different population or the same population in a different way than what we already have to offer? I think sometimes too, it's possible to get, for some of these institutions that are very much about technology adoption, to get technology overload. Like,
Yeah.
which robotic device do I choose for my patient today? And so I think really taking a strategic approach to what type of technology has the evidence to support, bringing on for the population that we serve in my clinical setting, and how can I justify, again, the value versus the cost. And then I think, there's more to technology integration than just getting it in the door. And I think that's where the facilities and organizations that do it well know that and continue to champion technology. So there's structure around therapists maybe having a train the trainer model, or really an understanding of the fact that integration needs knowledge translation, and making sure
Yes.
that there's savvy clinicians that know how to use the technology, they know how to apply it, and there's regular opportunity for sort of retraining or refreshing. And then also longitudinally, that facilities are looking at how the products are being used, right? So we get it in the door, we've done our due diligence, we know this is a product that has a good level of evidence, we're excited about it, there's technology champions to support it and people that can train within the facility. And then we're also regularly looking at how the technology is used and how it could be used better or differently. Maybe there's new research that shows its application to a different population, So it's not just kind of one and done, you've got this piece of technology, because then it comes in and it sits on the shelf.
Exactly. Yeah.
And we see that a lot. So it's very much an active process of technology integration that requires kind of some scaffolding at the clinic level to make sure that it's really successful.
Yeah. Yeah. I've seen that too, where you have some snazzy new piece of equipment and it's nice and pretty, and then it sits on the on the
And
shelf
then
in
it's
6 months.
a very expensive coat hanger after 4
Exactly.
months.
Yeah.
Yeah.
All right. Well, I know you mentioned it at the very beginning of the show, but tell us a little bit about this community you're building and about this tech rehab summit, because it sounds pretty interesting.
Yeah. So another OT and myself, her name's Rahima Hemraj. She's worked in tech on the age tech side, And of course, I've been in medical device research and development. And we, we've heard from a lot of clinicians that have interest in technology, and we've met with and interacted with a lot of companies that have a need for clinician input. And we really just wanted to create a community of folks that are both interested in better ways to integrate technology into their practice, as well as developing their skills potentially to prepare them for technology related fields. I know there are a lot of folks that I interface with that, maybe a PT or OT or speech therapist, and they have a love of technology. They have used technology in the clinic, and they're ready to see sort of in what other ways they can use their interest and experience to maybe guide technology development or be a beta tester for a new piece of equipment or a new device. So we just want to create some authentic connections around people that are using technology in rehab and those on the industry side that really need the value that therapists can bring to the table when developing new technologies to serve patients and clinicians in this space.
Yeah.
So we're excited about it. Yeah, there are a couple of different tracks for participants. So we have some career spotlights that'll walk attendees through stories like mine and other folks that have moved their careers from the clinic into a variety of different areas in technology, whether it be research or education, in tech or product development, or even as an inventor or entrepreneur. And then we have a number of skill building tracks that will introduce people to ways to integrate technology throughout the continuum, how best to leverage technology in your clinical practice, and even more specific skills like user-centered design and user research, and how we can use these kinds of principles to contribute to the development and further evolution of technology in the rehab space.
Well, cool deal. And what are the dates for that?
Yeah, we are running of course, the online or virtual conference, the 19th of February through the 21st. There'll be a number of both live interactive networking sessions, as well as a lot of recorded content. And folks have 90 days after the event to have access to all of the content as well. So I think we're close to 50 sessions of content now, and lots of opportunities to connect with companies and therapists, as well as even some of the professional organizations, really all centered around how do we use technology and how do we network with folks that are really interested in contributing to this space.
Yeah, that's awesome. And what's the link for that if people want to go check it out?
Yeah, absolutely. It's rehabtechsummit.com. So pretty straightforward. Our tickets will be up, and you can read speaker bios and look at all of the event content. And we're really looking forward to, again, creating a community and some great dialogue around the further development and the further incorporation of therapists having a seat at the table in technology development.
Yeah. Okay. Last question would be, where can people find out more about you, about the work that you do, if they want to connect?
Yeah, absolutely. Always happy to connect on LinkedIn. I think that's a place that we really encourage, particularly folks that are wanting to learn about technology and leverage their skills and maybe a tech-related field, to make sure that they're out and networking on LinkedIn. So find me there, and I would love to connect.
Awesome. Well, Lauren, thanks for the time. We'll connect all the links to the summit, to your profile, and all that in the show notes, so you can check that out when we're there. Thanks.
Excellent. Thank you so much.
Well, I hope you enjoyed that interview with Lauren Sheehan talking about tech in rehab, again, I think listening back and as I'm prepping this interview now to make it go live, whenever it does go live, it's always interesting to me where these conversations kind of go. And the idea of getting involved in technology and bringing tech to market and this new tool or this new piece of software, this technological device maybe that can help somebody better their life, improve their quality of life, you never get away from those core fundamentals, right? Even though it's something very unique, very proprietary in some cases where you're talking about specific patented technologies or softwares or codes or whatever. Ultimately speaking, it all comes down to some of those basics. And for me, at least, one of the big takeaways was that, again, that knowledge translation piece, the system that you have in place or don't have in place to make sure that the technology that you're bringing to market, that this new treatment technique, this new device, this new whatever, is not only brought to market or brought out, unveiled, if you would, but that it's sustainable for the long term, so that you have clinicians training new clinicians on how to use it and what's the best method and the best way to do it, that you're relying on the latest research, the published research about this device and its efficacy for these situations, for these cases. Because again, every patient is uniquely different, but we do need to rely on broad generalizations, if you would, in the literature to make those decisions. That's why I know we had this conversation a little bit with Barry French talking about Tracer. Lauren and I kind of mentioned it a little bit in the interview, like this idea that technology and AI and computer learning is going to replace clinicians is really at its root kind of unfounded, because what gives us value as clinicians is the ability to take in a sense, it's just our clinical decision making, right? Like it's our ability to take the data, the science that we know from research, and then integrate that or use that in a way to really make specific impacts on an individual and their individual circumstances and individual factors going on. Again, we take a biopsychosocial approach here, at least we should be in our treatment, and every person, even if they've got the same diagnosis, the same exact mechanism of injury, are going to be uniquely different in the way they recover based solely on their psychosocial factors. So the idea that getting more technology into healthcare or using computers to help us make some of those clinical decisions, the idea that kind of innovation in the space is going to lead to unemployment or lead to this rash of organizations laying off all kinds of clinicians, I think in the end is unfounded. I mean, sure, there are always people in every industry that lose their jobs and jobs go away because technology innovates, right? But at the end of the day, the people that provide value, that are able to provide value through their knowledge, through their insights, through their ability to take that technology and then use it as a force multiplier, if you would, in their clinical practice, are going to be the clinicians that have jobs for the long term. And it's just something that I'm super, super excited about, seeing the cool things that are yet to come in healthcare. I mean, technology is expanding at a rapid rate, and especially in the rehab space where I'm from as a clinician, as an occupational therapist working in physical dysfunction in the outpatient world, in the musculoskeletal world. We have not done a good job as an industry of leveraging the power of technology, whether it be in the data that we're collecting or not collecting, in the tools that we're using as treatment platforms, or as a mechanism for patient education and service delivery. At our clinic, Proactive, we just launched some service offerings that are, for lack of a better word, asynchronous telehealth packages for patients that involve it's a combination of inpatient, in-clinic treatment combined with secure messaging and asynchronous visits, if you would. And we're super excited about being able to deliver that because, one, we're the only one in the area that's doing it, but it's a real, to me anyways, and not because I just developed the idea, but it just seems like a very easy way to take technology that has not been used or utilized by clinicians in this space really at all, and do it in a way that's not just run of the mill. We're just going to do another, we'll take what you were doing in the clinic and we'll make it online, but really using it as an augment to standard traditional therapy. And I'm really excited to see how it develops going forward. I'm sure in like 6 months, maybe when I mention it again, it'll be a different, like, oh, this didn't work and we had to do this. And that's part of bringing innovation to the market. But again, I would just encourage anybody listening, whether you're an administrator, whether you're a clinic owner, whether you're a boots on the ground clinician, think about ways that you can take some of this technology that we already have at our fingertips and that we already use in other circumstances, and figure out how you can incorporate it into your treatment to either decrease the cost of care, improve the access to care, with the ultimate goal of improving the outcomes for patients in a way that is decreasing their overall cost. Because as we progress, as we keep on going, costs don't seem to be going down in healthcare. And anything we can do to save payers, to save patients money, is going to, again, increase our value and the job security, if you would. So if you're not doing it for any other reason than self-serving reasons, think about your job security. And if you're able to save people money, you're going to be fine. So anyways, that's it for this episode. Look for the next episode. So we're going to be talking with Dr. Ian Harris about his book that was published in 2016 called Surgery, the Ultimate Placebo. So it is going to be a great conversation around clinical decision-making, and Dr. Harris really challenges he's an orthopedic surgeon, but he really challenges the way we make decisions as clinicians based off of, maybe we make a decision because it's quote unquote standard practice or whatever. And he really drives home the point that just because it's standard practice doesn't mean we should be doing it, and it might actually be harmful in the long run. So look for that interview dropping in a couple weeks. If you like the show, if you like what we're doing, head on over to iTunes, leave us a rating and review. It helps people find the show. Or you can head on over to www.betteroutcomes.show, find a list of all of our previous episodes, links to folks, to the guests on the show if you want to connect with some of them. And that's it. Until the next time, guys, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabpracticesolutions.com. We'll catch you on the next episode.